name is McKenna. I'll be your student nurse for today. I'm going to wash my hands and put on gloves, and now I'm going to ask you for your last name and date of birth.
Aronowitz, August 18th, 2000.
All right, and do you have any allergies to food, medicine, or environment?
Nope.
All right, and can you tell me what the day is today?
October 28th, 2020.
All right, and where we are?
In our apartment.
And what we are doing?
Doing a checkup video.
All right. Well, first I will begin by taking the patient's heart rate and respiratory rate. So first I will find the patient's radial pulse and determine if it's regular or irregular, just regular in this case. And then I will start a timer for 30 seconds. All right, and then I'll multiply it by 2, which comes out to 88 beats per minute with a grading of 2. And now I'll pretend to keep taking the patient's pulse while I watch for respiratory rate for another 30 seconds. All right, and then I'll multiply by 2 again, which comes out to be about 14 breaths per minute. And now I will begin to test the cranial nerves. First, I will begin with cranial nerve 7 and inspect the patient's face for any swelling, if it's symmetrical, any drooping, which appears to be normal for my patient. And now I will test the facial muscles by having the patient smile, show her teeth, and lift her eyebrows, which appears to be bilateral, symmetrical. And now I will test cranial nerve 5 by the patient's jaw and testing for sensation first of the 6 points bilaterally. First with the dull, then with sharp. And now I will feel for the masseter muscles and jaw clenching, which I can feel the strength, so that appears to be normal. Now I'll inspect the patient's mouth and palates, which is cranial nerves 9 and 10. I'll have the patient stick her tongue out and say, ah. I'll inspect the uvula and the tonsils, which are, the uvula has proper phonation and the tonsils are graded for a 2, which is normal. And now I will check for tongue protrusions and have the patient stick it out again and move it side to side, which is cranial nerve 7 as well. Okay, it appears to be normal. And now I'll begin to look at the patient's eyes for any redness, swelling, drainage, itchiness. I'll inspect the lids, the conjunctiva, the sclera, and the cornea, which appears to be normal, no redness. And then I will begin testing, which would be cranial nerves 3, 4, and 6 for the 6 cardinal positions. So I'll have her follow my pen. All right, there appears to be proper muscle. The eyes move together symmetrically. And then now I will test the corneal light reflex, which I'll have her stare past me. And I can see the specks of light on both eyes, so there's no extropia or esotropia. And now I will test for pupillary light reflex and have her follow my pen light. Both pupils adjust directly and consensually. Everything is symmetrical. And then I will test for accommodation by having her following my pen light. Both eyes adjust properly to the distance, so accommodation is all good, which was cranial nerve 3. And now I will test cranial nerve 2, which is visual acuity, which normally I would have a Snellen chart or a Rosenbaum chart. Normally I would have the Snellen chart 20 feet away and the Rosenbaum 14 inches away to determine the patient's visual acuity. And now I have the patient stand up to test cranial nerve 8 hearing. I'll have her cover her right ear first, and I'll whisper and have her repeat. 1, 2, 3.
1, 2, 3.
And then cover her left. 4, 5, 6.
4, 5, 6.
And I'll test for both as well.
8, 9, 10.
And everything appears to be normal. And then I'll have her stay here so I can assess cranial nerve 11, which is shoulder strength. I will give resistance and see if she has equal strength going against my resistance, which appears to be normal. Strength was equal, wasn't lacking or anything. And now I will test hand grasp with the same amount of resistance and have her pull against. She has equal hand grasp and strength, and then I'll have her sit up on the table again. And I will test for leg strength by having her push against my resistance. Okay. And that will be all. Do you have any questions or concerns?
No, I do not.
All right. That'll be everything then.
Thank you.